Hello everyone, I want to talk about very small information about immunoglobulin A associated nephropathy and how would we determine the prognosis of the patient based on some criteria, and it can be diagnosed with biopsy. We also consider the blood pressure, systolic and diastolic, and proteinuria. It's very important. And apart from that, age, race, and the use of medication, the compliance of the patient, and MES score matters. And the prognosis is that the risk of 50% declination of the GFR or the progress of the disease in 5 years is about 40%. And I found this table very interesting, which shows the secondary cause of the IgA immunoglobulin-associated nephropathy, like gastrointestinal disease or liver disease, infections like hepatitis B, C, HIV, tuberculosis, and lepra. And apart from that, autoimmune diseases, we all know, and it can even suggest the malignancy or even the respiratory tract infection or even the skin disease. Here's a study that shows that the introduction of the medication with SGLT2 inhibitors, they have no risk for the kidney function, and they're even indicated in case of IgANephropathie. And what we have to look by such patient is we have to control the GFR. For example, this was from a patient at the beginning of the diagnosis and inducing the medication. The patient got anti-hypertension medication and SGLT2 inhibitor. And even the protein is measured, because at the beginning, 1.4 gram, it's a lot. After 14 months, the kidney function is controlled. It's 43 milliliter per minute, and it means the proteinuria did not got bad. Apart from that, the urine proteinuria got much less, which is a very positive result from the therapy. So protein is a very good marker to indicate the function of the kidney in urine, and based on that, we can make the prognosis of the patient for the kidney function and the life expectancy. And this is the summation of for the IgANephropathie. It is IgA dominant glomerulonephropathies, which has a lot of secondary cause we discussed, and it can be idiopathic. The standard diagnosis is through the biopsy and immunohistochemistry. And apart from that, what we have to do as a therapy for the patient is blood pressure management, diabetes control, and SGLT2 therapy is also nowadays applied. And apart from that, you can put this on it oral, and to reduce the inflammation of the duodenum ileum area. We have a new medication. This is sparsentan. It inhibits, it functions like angiotensin converting enzyme inhibitor, but additionally it also blocks the endothelin receptor, so it has two functions. So this was about the